Hello everyone, how are you? Welcome to my channel. This is Dr. Kim, and in today's video I'm going to share with you a case of a complete intrusion. Yes, you heard me right. A complete intrusion, presumably due to trauma of an 8-year-old patient. So I have two periapical radiographs that are taken from 8 months of each other. First radiograph was taken immediately after the intrusion, and then the second radiograph was taken 8 months after the intrusion, allowing for it to erupt on its own without any additional treatment. So here is the first radiograph. Again, keep in mind the patient is 8 years of age. You can see that the root apices of the developing the central incisors are wide open, and at the same time we can see the cusp has been broken, right? It's been fractured slightly, and this part of number 9 as well, presumably due to trauma. Compare the location of the crown. Obviously this number 8 has been intruded, and if I can adjust the contrast a little bit, here's the soft tissue outline. So clinicians have noted this as a complete intrusion. So it's been intruded all the way back into the socket. So what do you do when you have a complete intrusion? Well, as shown here, generally you don't have to do anything. It will erupt on its own. In this case, the referring clinician wanted to monitor radiographically, so I have the following radiograph taken 8 months later, from the date of trauma. So here we have the radiograph taken recently. If you compare the incisal edge of the crown, it's now much closer to the edge of number 9, and it has progressed or extruded tremendously over the course of 8 months. So that's what I wanted to show you. But if you pay close attention to the root outline, I do have some concerns over what's happened, perhaps due to trauma, perhaps due to intrusion. But if you look at the shape of the root, the outline of the PDL space, as well as the thickness of the dentin, do you see that it's much thinner than the contralateral side? It's thinner, especially at the cervical region right here. So I'm quite concerned about this area. Also, the thickness of the dentin is not quite as thick as the other side. Even the outer layer, or excuse me, the PDL space or the lamina dura, and the root outline is just not as smooth as what we see here. Okay, and if you look at the apex, this number 9 has managed to, I shouldn't say fully close, but it's managed to form the apex quite a bit since the previous radiograph, and it's pretty close to getting being somewhat closed, whereas if you look number 8, the apex is still wide open. Although it has managed to erupt, it still hasn't formed much of the roots, unfortunately. And in addition to that, as I drew your attention earlier, you can see that there is a large radiolucency, which may represent cervical resorption at this site. So it would be important to continue to follow this tooth radiographically to see whether this resorption has arrested or stopped, or whether it's going to continue to progress moving forward. So here's a case of complete intrusion and the eruption that has occurred over the course of 8-month period. Thank you very much for your attention. Hope you liked the information that was shared here. Please hit the like button and subscribe to my channel. I'll see you in the next video. Thank you.